Hey y'all, Shelly here with another tip for hospice nurses. So today I'm talking about managing pain in patients who have a cancer diagnosis. So I've always believed that it's so important with cancer patients that we see them frequently, that we assess them frequently, because they can have what will appear to be a rapid change. Generally, though, there will be little subtle signs early on that a change is about to occur. And with pain, especially, this is really important because we don't want to go from a 3 to a 7 and try to manage that, because if we let the pain get too out of control, the way we have to manage it can a lot of times just leave the patient so drowsy that all they want to do is sleep all day. And we try to avoid that. So it's important to see your patient frequently. Educate the patient about how important it is that they let us know any change that they're having in their level of pain. Even from a 3 to a 3.5 or a 3 to a 4, they need to communicate that with us immediately. If there's something they were doing that now they just don't do anymore because it's uncomfortable for them, that's a change in their comfort and they need to let us know. And I always tell my patients this on admit. Even if it's on a Monday and I'm not coming back till Friday, don't wait till Friday. Call the office. Leave a message for me. Call me and let me know that you're having a change, because I need to call the doctor with that right away. Or I need to notify the doctor of that, because with cancer patients, if we do small incremental changes, we're able to usually keep them comfortable and not decrease their level of consciousness, because their body has time to adjust to these small little changes. And if we just keep doing that all along, even as we get to the higher doses, their body has adjusted to it. So they will have their comfort managed, but not be so tired and drowsy that they really can't function. The other thing that's important is to assess what you think this person is going to be like down the road. And that may determine the type of intervention that you're going to do with your pain management. If you think that they're not going to be able to swallow, probably we don't want to start them on a medication that we know we're going to have to increase the number of pills. Because there are some medications that you can increase the milligrams, but you increase the number of pills or the amount of time you give it throughout the day. But if they're going to have trouble swallowing, we may not want to do that. Or medications that cannot be crushed, probably may not want to do that. So early on, especially if you know pain is going to be an issue for this patient, look at administration routes that can be given to somebody who can't swallow also, and work with your doctor and your palliative pharmacist. Communicate this well with both of them to make sure that we start them on this route early. And the last thing that's important is to assess your patients, what their feelings about pain are. Some patients have a lot of fear with pain, and if we help to assure them we're going to manage the pain and we manage their pain well, and we also may need to give some medication to help quell some of this fear, then that also helps to manage the pain. But there's a flip side to that too. I had a patient once who believed that her life was too easy, that she had led this wonderful life, and she felt that in order for her to go to heaven, that her God wanted her to suffer. And so she would not allow us to give her any pain medication at all. And she had a type of cancer that was painful. And so knowing this early on, I was able to bring in the social worker, her spiritual leader, our chaplain, other people for support, because while she did not allow us to give her anything for pain all the way up until she died, we were able to do some other interventions, some non-pharmacological, that's hard to say, interventions for pain. But we were also there to provide extra support for the caregiver, because this was tough. This was hard to go through and it was hard to watch. But we did honor her wishes. So you need to know that up front, though, so we can put that infrastructure in place. So I hope this tip was helpful. If there's anything you'd like me to talk about, please let me know. I would love to share it here. And y'all remember, if we work together, we can change our world.